Hi and welcome to my channel. My name's Lauren from Lauren's Cravings over on Instagram. Today's video, I'm just going to have a chat to you about what you can expect after you have your baby. So directly after delivering your baby in hospital. Now this is based off of my experience. So if the circumstances around your labour and baby's birth deviate either in how they're delivered or complications or otherwise, obviously there might be different outcomes, but what I will try to cover off are the common and general themes for after, what you can expect after delivery in terms of what they offer you, and also conversations you should be having. Following my experience, I'm also going to give you a bit of advice on why I would probably choose to give birth in a labour ward now, as opposed to my initial desire to give birth in a midwife led unit. Totally personal preference, but following my experience, that would be my choice going forward. So I'll give a wee bit more detail on that, and also just some advice based on my experience as well. So I hope you enjoy, and let's kick off. So just for a bit of background, I gave birth to my baby boy Bryce on the 6th of April 2021 at the Royal Alexandra Hospital in Paisley. Now, I don't live in that vicinity. I'd specifically chosen to go to Paisley because I wanted to give birth in the midwife led unit. If you've watched my part 1 and part 2 labour story, you'll understand that I never managed to give birth in the midwife led unit. One, because they'd closed it due to the labour ward being exceedingly busy and no one being in the midwife led unit, so they'd brought the midwives downstairs to help in the labour ward. And 2, because I went in and I was basically fully dilated. So they said that I didn't have time to go upstairs, and the whole point of me going to the midwife led unit was because I wanted to use the birthing pool, and it takes about 20 minutes to fill the birthing pool, and I was at pushing stage when they wheeled me through to a labour ward. That is why I never gave birth in midwife led unit. Obviously at that point I did still want to give birth in midwife led unit, but I will get onto that in the latter stages. So we'll just go straight to Bryce has been birthed and what comes next. So I had read up on this, and I had received information from the antenatal classes that I'd done with the Baby Academy, and also Lindsay of Born This Way Hypnobirthing. So your baby is birthed and put on your chest. Now this is, barring any complications. I didn't have any, so I think I had about an hour and 10-minute pushing phase. So ideally you want skin to skin. So the baby is brought up, put on your chest, and this is regardless of whether you are formula feeding or breastfeeding. It does not matter. They call it the golden hour. They want you to have the baby against you on your skin with obviously they're naked at the time. Now, they generally can be a little bit cold to begin with. Now, the midwives hadn't taken the baby straight away. They only take the baby if there is something wrong. Ideally, all going well, it will be put straight on your chest for a considerable period of time. Now, the baby sometimes is quite cold. It's never been out in the environment before. So what they tend to do is give you lots of blankets just to make sure it's bundled up over the top of the baby. They do not fully wrap it because they want the baby's skin to actually just be flush with your skin. So if you have, I was given birth in a tank top. So I obviously had that section kind of free. If you're wearing something that's totally covered up, ideally you want to be opening it. You want to be exposing your chest, your skin, whatever. If you only want to wear like a nursing bra or something. I think I ended up taking the tank top off. I think I also ended up taking the nursing bra off because obviously I was wanting to breastfeed, and ideally you want to get that first latch in as soon as possible. And with the midwife's help, I did end up doing that, but the baby did just lie on me for a little while because you're in shock. Quite frankly. So before I tried to latch Bryce, I was just lying with him on me for I think about 10-15 minutes before the midwife, after the next stage they came and helped me. So skin to skin is obviously straight away, that's what you're hoping for. It's just to cement the bond, to make your baby feel safe and secure and get some heat into it. So how they talk about out in the wild, you're better even stripping off naked to get warm. That's why the skin to skin is really critical as well. Whilst you're lying with the baby on your chest, in an ideal scenario, the placenta will still be inside you. So the cord is still attached to the baby and to the placenta, which is still up inside your womb. Now, they obviously want to cut the cord. They leave it for a few minutes. So there are 2 different ways of, they call it delayed cord clamping or optimum cord clamping, right? So the one that is delayed is just a few minutes. They used to cut it straight away. They don't do that anymore because they want to make sure that there is a blood transference, post-birth to the baby. So they wait a few minutes and then they will initiate cord cutting. Jonathan did decide to do the cord cutting, so he ended up coming over. They set up a little bit, they cut the cord, and then they attach a clamp. Now, I had also taken in an embroidered cord clamp now, which is, and this, again, look into it yourself if you want to. We ended up having to swap it when I was put up into the recovery ward because they didn't do it at the time. They just decided that they hadn't done it before, they hadn't placed one, they were going to clamp it and then we would deal with it thereafter. You can have a discussion. Obviously, my labour was extremely quick. We didn't have much time to look at the birth plan. We didn't have time to really discuss anything because by the time, everything was happening, I was in the pushing phase and we were through there and it was all go. So if you have a little bit more time, you can discuss with them in advance if you want to use an embroidered cord clamp. I had a little badger one that we attached thereafter, and it really is just meant to be soft on their skin. It's not a hard plastic thing, that you've got to get out of the way of the nappy and whatnot, because you want to keep that out of the nappy so that it's at the air. And also just for breastfeeding, so that I didn't have something hard and plastic pressing against me. Personal choice. But I would recommend it. We kept it dry. Obviously, you don't need to bathe a baby for up to a week after, and it's actually better if you don't, because it allows the cord to dry out better and fall off. Bryce's came off in 5 days. So that's cord clamping. That is what comes next, and then we're going to discuss the options for delivering the placenta. So delivery of the placenta, so there is a choice of an injection to help artificially deliver your placenta. Now, you can choose to deliver it naturally, but be aware that there is an increased risk of, more bleeding, understandably, because it takes longer. Because of the delay, if you end up having any placenta retained within you, you might end up needing to go to theatre. So that just prolongs that whole process, and as I said, prolongs potential bleeding, which increases your risk of a blood transfusion, etc. Look into it yourself, but with the injection, basically they inject you, they ask you the question, they inject you, and you deliver the placenta generally within about 5-10 minutes. It doesn't feel bad at all. It just kind of feels like, I'm trying to think, it's like a gush. So already, if you think of it, your cervix is dilated 10 centimetres, you've just pushed a baby out of it who has a solid head. See, delivering the placenta, don't be concerned about it at all. It just kind of felt like this kind of like rush and whoosh out of me, and they delivered it. I didn't even see it, and I wish I had. Jonathan did see it, and he said obviously it is quite impressive, you've grown an organ. They didn't offer, they did ask Jonathan, did I want to do anything with it, or was I happy with them to just throw it? I didn't want to do anything with it at that point in time. If you are considering placenta encapsulation at all, or want to do something with it, or want to look at it, anything at all, just make sure that you communicate that with them, or your birthing partner communicates it with them. I should mention, obviously not my experience, but if you choose to deliver the placenta without any injection, because there is a risk of sickness with the injection. I heard, I didn't feel sick at all, but there is a risk of it. So just what I said in my labour stories, if you have any concerns at all, ask the questions, ask what the potential risks are, ask what the potential impact is. So we had that discussion slightly. They asked about the injection. They said there was a risk of increased bleeding, which I knew. I chose to have the injection. If you deliver it naturally, it can take up to 30-40 minutes, I believe. They may, at that point, if you're choosing to deliver it naturally, they may choose to massage the stomach slightly just to encourage it to detach, because ultimately when the placenta detaches, you're left with like an open wound, so there will be increased bleeding. And we'll go on to that for when I stood up, because you are bleeding quite profusely. To the point I was dripping on the floor when I first stood up, and that is because you have an open wound where the placenta is detached, and amongst other things obviously, but that is an open wound which will be bleeding. They then weigh the baby, obviously. They give you this option, whether you want to do it now, whether you want to do it later, and this was because obviously everything was absolutely fine with Bryce, so we chose to get him weighed. They took him away, they weighed him. They will only measure the length if you ask. So we didn't ask, and I've been told, and as I've read up, it's just not something that's commonly done anymore. I think it used to be historically, and it's not really now. Your health visitor and all that will do that when you are back home, and they will start measuring length, but it's not done as general practice, at least in Paisley, Glasgow, anywhere locally in Scotland that I have spoke to people about, unless you ask. So if you want the length of your baby measured, ask them to do that when they're weighing your baby. As well as obviously wrapping the baby up, I had actually asked if they were going to wipe the baby down again, clean it at all, anything, and they actually said no. So they encourage you not to do that. And if you read up, I think I've got a book about the gut health of babies. There is a big benefit to vaginal delivery because it actually gives them a lot of, forgive me, right, because I'm not going to go into an awful lot of detail because I haven't read up on it that much, but there is benefits to the baby's immune system with a vaginal delivery, and just giving them some, don't know whether it's bugs and, you know, antibodies and all that sort of thing. But when I asked could they wipe him down, because he did have like some gunk in his hair and whatnot, they said that they wouldn't, and they encouraged me not to either. So he was left with a little bit of like gunk and whatnot, which obviously hard and kind of came off, but until he had his first bath at 7 days, he wasn't pristine. Obviously I got to a point there was little bits of like dried in blood on him, and I got a wee cotton pad with water and kind of like wiped him up. Because in some photos I was just like, he looks like he's just been delivered, and this was like 2 days later. So they will not bath your baby. I don't know if that's because I'd spoken to my friend and she said I think that they did do that with hers, but in my experience I did ask for him to be wiped down and they said no. So whilst Bryce was over getting weighed and then Jonathan was going to hold him, this is when they do the inspection of down below with me. So obviously you've just given birth, you're covered in blood, you've birthed the placenta. They need to give you a kind of wipe down, clean down, and then inspect you for any tears, skin abrasions, anything at all. And this is where we'll lead into why I've changed my mind since on the Midwife Led Unit versus a labour suite delivery, which has consultants available, which has, you know, clinical practitioners that are there for the purposes of ensuring that you get the utmost best care. And I'm not saying I didn't get the utmost best care. I haven't discussed this on my Instagram at all, so if you have made it this far, you're about to get an insight in something that I have not discussed anywhere else. And I said to Jonathan that I probably wouldn't, but I want to give some advice, and it's got to a point that I'm probably going to complain. Interestingly, I was in for a follow-up appointment yesterday, so I'll tell you the story first and then we'll kind of come back around to my aftercare, as it were. So clean me down. They basically prop your feet up in stirrups, wash you down with water, and then inspect you. Now at this point, as I have mentioned on my Instagram, I did not tear my perineum, which is the area between your vaginal opening and your anus. I'm using lovely words here. Obviously, I'm getting a bit nervous, so don't mind me. I hadn't tore there. Now, if you've watched my prep for labour video, and what I kind of think the essential things are in pregnancy, one of them was that I did perineal massage. I would highly recommend it. Having seen a consultant since, she says that was probably a big part of why I did not tear down there. I think about 80% of women tear in that area, especially as a first-time mum. So if I can encourage you to do anything, if you have not watched that video, do perineal massage. And the hint that I give, especially in later stages of pregnancy, if you cannot reach it, use your vibrator. Okay, so I've done that before. I've said this in other videos. I'll just say it again because we'll move on to where I did tear, which I did not know was a thing. And again, if you have followed me on Instagram or you've listened to these stories, I did a lot of research. I read up on things. I followed a lot of people. I went to classes, and I did not know you could tear where I tore. Was I told that though? No. So what I was told is you've not really torn anything. It's just kind of skin abrasions. There is a cosmetic issue. Well, not a cosmetic issue. She was like, it's a cosmetic tear, I think is what she said. Didn't give me details on the specifics. And with hindsight, I should have pushed that. So in this discussion, if you're in any way not clear on things, please, you or your birth partner ask for clarity. So we were told it's cosmetic, and I was given the option, do you want me to stitch it? Because it is only cosmetic. And I was like, oh, yes. You know, I looked to Jonathan and we were like, well, yeah, because obviously if there's something wrong, then we want to get it dealt with. And she went, right, that's fine. I've not stitched that area before. Now that should have sent alarm bells ringing for me, because you know, I've got a midwife there that seemed experienced and said that she hadn't stitched that particular area before. And I was like, right, okay. She was like, so I'm going to go and get a consultant. And I was like, cool, absolutely fine. Consultant came in, looked at me, and all the while, obviously, I'm sitting there kind of just like legs up, looking over at Johnny with Bryce. And she was like, oh, that'll be no bother. Just stitch there and there and you'll be absolutely fine. And then she left, right? So in hindsight, why was I left with a midwife who had not stitched that specific area without any supervision, and what I believed at the time was a consultant not doing it? I've since learned that that was all, it was just another midwife. So she said she was going to get a consultant and it was a senior midwife. I was only told that yesterday. Bear in mind I'm recording this in August and I gave birth in April. So she stitched me up, fine, cool, and went on my merry way. Now, we're about to jump into why I would not give birth in a midwife led unit now, just in case this sort of thing happens. So just from my experience, I would always want there to be a consultant on hand now with experience for these types of scenarios. And it's not a big deal, right? But the long and short of it, I was stitched in the wrong place. So I ended up tearing my inner labia, right? Now, I have quite a neat area down there, so there wasn't that much to work with. And it's probably why I was fobbed off in later visits just to triage, because they're all kind of going, well, it's not that bad, you know? But basically the top stitch, where she should have attached to the little bit that was left over, I know I'm not giving you much without showing you a pictorial diagram, but she had, instead of stitching the inner labia back to the top section that had torn off, she stitched it onto my clitoral hood. Now you can imagine what kind of pain I was in. And that caused me to have to go back to triage 5 days post-labour, where I was sent home again with antibiotics, having seen a registrar with comments that it looked fine and it would repair itself. And I ended up going back again because I was still in significant pain on day 10, I believe, because I was crying because Jonathan had showed me a photo of it. And it honestly looked as if it had been pulled out and up. So it was like swollen and clearly out of place. Now I have pictures of this. And I'd sent them on to Lindsay. And this is why I would recommend again why Lindsay is absolutely amazing. She sees you through everything. She is a trained midwife. I sent her photos of down there and I was like, I'm so sorry, but I need some advice. And she's like, Lauren, I think that top stitch should be removed. It doesn't look as if it's in the right place. I think it would do better if you actually just got it removed. So I went in and they were like, it's fine. Now I was seen by this doctor and she was like, it's approximated, looks fine. And me and Jonathan are sitting there going, it's not approximated. Now stitches, right, should be closing a wound like that. The top stitch was like attaching an opening, right? Well, not an opening, but it had been pulled up and out and it was attached up here when it should have been attached down here. It was not approximated. But we were being treated as if we were in a twilight zone where what we were seeing wasn't real. Or I think that we'd photoshopped it because they were like, yeah, but a photo's different from what you see down there. It's not that different. It's not that different. So I basically said, remove the stitch, I'll deal with the consequences. They couldn't do anything at that point because obviously the wound had started to heal, and obviously really upset. That was the only thing that had really upset me. My labour story was absolutely brilliant up until that point, and hence my story, and I know I've went into a lot of detail there, but See if there is any ambiguity or you're getting any hint of, not having the appropriate capability or experience and you're not comfortable with that. You're in a vulnerable position, because I'm assuming the person watching this is the one that's about to give birth. Please say to your birth partner, if there is any hint of that you ask for a consultant. If somebody says to you that they have not done this before, at least they should have had someone supervising them. They said that they were going to ask a consultant. I've since learned, now that I've went back to an actual consultant for 2 visits, this is after my 2 triage visits, that it wasn't a consultant, it was a midwife. And I have since had it confirmed that I was stitched in the wrong place. And I'm at a point now where I could get it repaired, but there is literally that little flesh to work with, that it could have a long-term impact on my sensitivity, i.e. like during sex, I could be in pain. I could have a constant dragging feeling if they were to do this in a day clinic. And this all could have been resolved had it been stitched properly in the first place. And you have no idea how much that frustrates me and sits with me still now in August, 4 months later. So I've got a decision to make. I've been offered it. I'll decide whether I want to, but the risk is that I am left with a constant dragging feeling or pain. So annoying. And what bothers me, and obviously she was apologetic. The doctor and the consultant that I've dealt with since then is amazing. She was amazing, and was the only one that's probably validated my feelings in the whole process. And that's why I'm getting to the point that I think I want to complain, because I saw numerous healthcare professionals through that. Not only was I stitched wrong, I was told in the first visit to triage that everything was fine. I was sent home with antibiotics whilst I had a stitch in my clitoral hood. I was told by the doctor and then another person, I don't know if he was another registrar who, but there was 2 doctors in my second visit to triage where I asked for the stitch to be removed, who told me that everything was fine. And I've since had it confirmed by a consultant that everything was not fine. So why was I allowed to be left that way? Please, please, please do not end up in the same situation. Up to you if you want to deliver in a midwife led unit. If I had been up in the midwife led unit, it may still have happened. I'm going to choose to give birth in a labour ward, and I'm going to force for whatever my second, because if I am lucky enough to have a second child, I am going to make sure that I am given experienced and someone who is confident doing something if there is anything like that going on. See if you end up with a tear. Please make sure you're having these conversations. And this is a big part of why I wanted to do this video. Obviously sharing quite intimate and personal details, but I really don't want anyone to be left in the position that I was left in. And I am left in. And it's not that bad. Doesn't look that bad. But see, knowing it was avoidable plays with my head. It honestly it still plays with my head and pisses me off and annoys me and all those things that you can imagine. So overall, labour story, great. I wish, knowing what I'm like as a person, I wish they told me, because they did not tell me what it was. They did not tell me it was such in close proximity to my clitoris. They did not send me home with any painkillers, even though in the visits to the triage since they told me, such a sensitive area though, it's such a sensitive area. See, if it was such a sensitive area, you should have given me all the information in the first place and I should have made the decision, 1, who stitched me, and 2, why did you not give me any painkillers? Anyway, I won't labour the point, so that I will get on to the recovery bit. I know I've kind of spoke for 11 minutes. Can you tell I'm passionate and really annoyed about this? We'll get on to the recovery and what happens after that. So at that point, I had no idea. I just thought I was stitched up well and good. Let's move on. So I'm stitched up and the midwife asked me if I want to latch Bryce on for breastfeeding, if I want some, help doing that. So I get the baby back off Bryce, put him back on me, and they give me help latching him on. At that point, they also ask if I want tea and toast, the famed tea and toast. And they give you a wee bit of time, basically, as a family. So they went out to make the tea and toast, came back in, dropped it off, and just give you 10-15 minutes where they go out. They give you a button if there's any issues, obviously, or you've got any problems, and they tell you to press it. And they just leave the room and give you some time alone. So enjoyed our tea and toast. I sat with Bryce on me, had him obviously on the boob, and then just back on top of me. And I did want to go up to use the toilet. So I gave the baby back to Bryce after probably about 15 minutes after enjoying my tea and toast, and I got up and there was more blood kind of like falling out of me. And this is where I was saying kind of like, don't worry, because I did press the buzzer because I was like, oh my God, that's still quite a wee bit of blood. And they came in and they were like, don't worry about it. It's just what's going to happen. So just kind of like pad yourself up, take you through to the toilet. And that's when they offered me to have a shower as well. They actually measure how much blood comes out of you. So that's something I should have mentioned previously. That is a measurement that they take to determine whether you need like an injection, whether they need a blood transfusion, anything at all. They will measure how much blood you have lost and make a decision based on that. So they were comfortable with how much blood I'd lost, told me not to worry, got up and basically helped me to have a shower. So you have a shower. I didn't use any products. It was just cleaning all the blood down for myself and giving myself a wash down. Down there, you don't want to be using any products anyway. So I was in there for probably a good 15, 20 minutes because I was just still kind of like bleeding. And I did just take my time. Have my shower, come out, sit down, basically latch Bryce on again after taking him back off Jonathan, and they come in and offer some more tea and toast. So at this point, you are offered quite a wee bit of time, just you and your birth partner with the baby. They left the room and left us in that room, I think, for, and this is the labour suite, so you've not moved up to the recovery suite yet. I think it was a good hour and a half. Obviously, they give you the buzzer if you need anything, but a lot of the time they are just letting you bond with the baby, letting you kind of have discussions, kind of like process it, which was quite good. I didn't know whether I expected, for things to be processed quite quickly. Obviously, I get told it was busy, so I didn't think, they would let you stay in the labour suite for such a length of time, but they did. So good in that sense, and basically they come back in after a while and say, are you ready to move up to the recovery suite? I don't know what it's like in hospitals in terms of allowing birth partners to do that. I think they allow them to go up to begin with. Jonathan stayed with me the whole time. We actually get taken up to the recovery suite. It was part of why I'd chosen Paisley. We were the only people in there, and it was a room of 4 beds. I think the Princess Royal is 6, and that is generally full. My 2 friends that gave birth in February and March were in a full ward. So the whole time we were there, albeit it was only for about 6 hours I stayed in the hospital there after Bryce was born, we were totally alone. Take you up to the recovery suite. We were offered lunch, so we got some soup and sandwiches, and you are waiting for the baby's health check. So they get their ears checked by someone, and also then you get a doctor to come along and do all the paediatric checks. So check the knees, I don't know why I specifically chose knees there. Listen to the heart, check the head, check all these kind of like joints and whatnot in the hips. So we were waiting for all that to be done, and then I chose to be discharged. If you choose to stay in, obviously if you want help with your latch, if you're breastfeeding, I knew I had a really supportive community on Instagram, and I had friends that were breastfeeding as well. Plus it was COVID times, and I didn't really want to not be there with Jonathan, so I knew I could have him if I was home. And also if you want to be seen by a physio, if you stay in the hospital, the maternity physio will probably come round and visit you as well. I don't have much to say in that respect because I gave birth at 8 in the morning. I was out of hospital by 4 in the afternoon. So I know mine was a quick turnaround. I've tried to give you an overview of what happens like up to that point. Thereafter, you'll probably need to listen to other videos or speak to somebody else about what what services are offered. Advice in terms of breastfeeding probably. Because they did say that I could have stayed in, specifically because I was breastfeeding, and they would have offered that support, but I chose not to. So I hope you found that informative. Apologies for my little rant, but I am obviously having been left in the situation whereby I was not stitched in the right place. It was not a great experience, and the aftercare thereafter until I saw the consultant was not what it needed to be either. So if you take anything away from this video, just make sure specifically your birthing partner is aware of red flags to really be to look out for, and to probe and ask questions and demand why you think you should have someone that is more experienced or that it is a consultant. And please clarify that it is a consultant, because I was told it was and it wasn't, and I only learned that yesterday, 4 months postpartum. So please like and subscribe the video, and I know I say this in every video, but I really would appreciate if you comment. Taking quite a wee bit of time. I'm trying to there we go. Bryce's nap time is over. This is where I'm trying to use time to record these. So if you could show support in any way possible, I would really appreciate it. And thank you for listening. Speak to you later, guys. Bye.